today, my topic is going to be on blood cancer. Okay, so what is blood cancer? It's exactly what it says. It's cancer that affects your blood cells. And blood cancer affects how your body produces blood cells and how well those cells work. So there are different types. So the three main types of blood cancer are leukemia, lymphoma, and myeloma. Leukemia is blood cancer that originates in the blood and bone marrow. It occurs when the body creates too many abnormal white blood cells and interferes with the bone marrow's ability to make red blood cells and platelets. There's acute leukemia and there's also chronic leukemia. Then there's non-Hodgkin's lymphoma, and it's a blood cancer that develops in the lymphatic system from cells called lymphocytes, a type of white blood cell that helps the body to fight infections. Then there's Hodgkin's lymphoma. It's a blood cancer that develops in the lymphatic system from cells called, again, lymphocytes. Hodgkin's lymphoma is characterized by the presence of an abnormal lymphocyte called Reed-Sternberg cell. Then there's multiple myeloma. It's a blood cancer that begins in the blood plasma cells, a type of white blood cell made in your bone marrow. So what are the causes of blood cancer? Blood cancers are typically caused by changes in the DNA within the body's blood cells. Usually, blood cancers stem from an excessive reproduction of white blood cells in your body's blood-forming tissues and organs. Blood cancer often begins in the bone marrow where blood is produced, or in the lymphatic system, a major part of the body's immune system that manages fluid levels. Risk factors vary based on the specific type of blood cancer. So risk factors for developing Hodgkin's lymphoma include a history of infection, Epstein-Barr virus, which causes infectious mononucleosis, advancing age, gender being male, family history of Hodgkin's lymphoma, and a compromised immune system. Risk factors for developing a non-Hodgkin's lymphoma include exposure to certain industrial chemicals, herbicides, and insecticides, history of chemotherapy, radiation exposure, compromised immune system, history of autoimmune diseases such as rheumatoid arthritis, or even lupus. Risk factors for developing multiple myeloma includes advanced age, gender being male, race. Higher risk factors are among African Americans and obesity or extra body weight individuals. Risk factors for developing acute myeloid leukemia. This is the most common form of leukemia in adults. Risk factors include advancing age, gender being male, exposure to industrial chemicals such as benzene, smoking, history of cancer treatment, exposure to high doses of radiation, and history of other blood cancer. So what are the signs and symptoms of blood cancer? Some common bone marrow and blood cancer symptoms include fever, chills, persistent fatigue, weakness, loss of appetite, nausea, unexplained weight loss, night sweats, bone and joint pains, abdominal discomfort, headaches, shortness of breath, frequent infections, itchy skin or skin rash, swollen lymph nodes in the neck, underarms, or groin. You can also have swollen lymph nodes on your underarms if you shave, so don't necessarily think that it is cancer. Just make sure you get it checked out. Signs and symptoms of blood cancer in children, but they do get it. Although childhood cancer is rare, leukemia is the most common in children. Signs and symptoms are when the number of red blood cells is low, the child becomes anemic and may become pale, listless, and easily tired. When the number of white blood cells is low, the child is more likely to get infections and may have a fever. When the number of platelets is low, there may be bleeding problems such as nosebleeds and increased bruising. The child may also have bone pain. Spleen and abdomen may be enlarged and are tender to touch in children. So how is blood cancer diagnosed? Diagnosis often starts with a physical examination to check the patient's general health. The care team reviews the patient's health history, examines his or her body and lymph nodes, and looks for signs of infections or bruising. Different types of tests and procedures may be used to diagnose blood cancer. What each patient needs depends on the type of blood cancer suspected. The care team may recommend testing and evaluate all the results along with the patient to make a diagnosis. They may do a biopsy, imaging scans, which include CT, MRI, PET scan, X-rays, ultrasound, as well as blood tests. Blood cancer treatment. Treatment for blood cancer or bone marrow cancers depends on the type of cancer, the patient's age, how fast the cancer is progressing, where the cancer has spread, and other factors. Some common blood cancer treatments for leukemia, lymphoma, and multiple myeloma includes, and are listed below, stem cell transplant, chemotherapy, radiation therapy, and immunotherapy. Blood cancer prevention. There is no definitive way to reduce one's risk of developing blood cancer, but certain lifestyle changes can help decrease the risk. Avoid exposure to radiation and cancer-causing agents and chemicals, such as pesticides. Quit smoking, stay active, eat healthy, and maintain a proper sleep schedule. Genetic testing is also available for certain types of hereditary blood cancer. If you believe your personal or family history puts you at high risk, consult your doctor about the options. I want to also encourage you that when you go to have x-rays, any kind of scans, you can also get a thyroid protection to make sure that you don't develop anything there as well. Let's say you know someone that has blood cancer. Remember, blood cancer and blood cancer treatments can take a toll on their overall health. Here are some suggestions that may help. Try to encourage eating healthy every day. Blood cancer treatments may affect their appetite. Fatigue is a common symptom and treatments side effect. Pay attention to the person's body, rest when they need to rest. Protect them from infections. Get exercise. Talk to a healthcare provider first if you feel so. Pay attention to emotional health. They can become depressed at times, so please be patient with them. If they're in remission, they probably feel relieved and want to stop treatments. Some people live for years with blood cancer. It's not always easy to have a chronic illness. Talking to a therapist or finding a support group may help one navigate the challenges. A reminder, thanks to new and more effective treatments, more people are living with blood cancer than ever before. More than 1 million people in the US alone are either living with blood cancer or with blood cancers that is in remission. Healthcare providers and researchers are making progress toward finding a cure for some blood cancers. That's great news, of course, but blood cancer is a serious illness, and learning you have a form of blood cancer is serious business. If you have blood cancer, ask your healthcare provider to explain how blood cancer will affect you, your treatment options, and what to expect. Also, remember there are several support groups available, including the American Cancer Society. I want to give special acknowledgement to the American Cancer Society, New York Presbyterian Hospital, cancer.org, cancercenter.org, and the Cleveland Clinic for the information that I provided you today. I hope this was helpful. Should you have any questions, please join us in the Zoom room immediately after service. And remember, tonight, we have all-night prayer, and we are going to seek God like never before. That includes the nurse. I'll see you there. God bless, and have a wonderful day.